I'm Katherine Cheney, Senior Editor for Special Coverage at Devex, and I'm thrilled to be joined by Sarah Joy Malaba, Co-Chief Executive Officer of Tiko, an Action for Women's Health awardee. Sarah, thank you so much for joining us.
Happy to be here.
So I'd love to start by hearing a little bit more about what inspired your work and what specific challenges you set out to address.
So what inspires me to come to this work, first and foremost, is my own personal loss. At the age of 24, I lost both my parents to HIV, and at the time, the world around me completely collapsed. I was grieving and trying to raise my 3 siblings who are younger than me, and that's when another woman showed up for me. Her name is Professor Ruth Onyango. I was working with her as an intern, and what she did for me changed the trajectory of my life. She turned me into a paid worker, which afforded me a salary, and so I was able to raise my siblings. I think that my life would have turned out differently if it were not her showing up for me at that point in time. And so I spend my days as co-CEO of Tiko, leading our program strategy, making sure that I show up for girls in sub-Saharan Africa who face the triple threat of unintended pregnancy, HIV, and sexual violence. Tiko has been doing this for the last 10 years, but most recently added on the piece around addressing sexual and gender-based violence, because data shows that it's the biggest driver of unintended pregnancy and new HIV infections among adolescent girls.
I also know that technology is an important piece of your model, and I wonder if you can tell us what you've learned about the role of technology in building trust and reaching young women, especially women who might otherwise be left out of traditional health systems.
That's a great question. And indeed, at Tiko, the type of adolescent girl and young woman that we reach is termed as the most vulnerable. They would be likely the most unaware about their sexual reproductive health needs, have the least access, and have no way to afford the critical care that they need. And this is a girl usually living in an informal settlement in an urban and peri-urban area of Africa where we work. So what technology does for her and how we think about technology is that it creates an ecosystem of service delivery that is closest to the girl. This girl that we work with and serve and impact doesn't need a phone to be a Tiko member and doesn't need internet or SMS access. What she can get is a card like this. It's a Tiko card that's a QR-coded card that's unique to her. However, the ecosystem that we work with that includes community mobilizers, healthcare providers and clinics, and retailers need applications that are specific to them so that we can, for example, tell where was this girl found when she was mobilized and given information. Then she gets enrolled onto Tiko. Which service did she get because the provider will log on that service? Which redemption did she take and at which shop because the retailers will have a retailer app? But what does the technology does for us concurrently is that it records at real time what is going on with this girl. And we are able to make her visible. Otherwise, she would have been invisible. We can tell where the health system breaks down for her if she comes for one or multiple services. And so we are able to leverage on technology as a means of finding her, following her, and supporting her user journey so that she does not only start on care, but can continue on it.
I know your model relies on collaboration. You're linking users, health providers, and private sector partners through this single digital ecosystem. I wonder if you can share what makes these partnerships work and what lessons might other organizations take from your experience.
There are fundamental aspects of what makes this model work. And I think the most important one is that we have a shared value around making the system stop failing adolescent girls. And by that, I mean that in this model, the partnership is committed to increasing awareness among adolescent girls around sexual reproductive health and their rights. It is committed to expanding access, and that's why we can leverage on both public and private facilities that exist closest to the girl. And we believe in removing costs for this girl because, as I said, this is a girl who is living in most disadvantaged circumstances in an informal settlement in an urban area. So it is important that the model accepts and enables her to access service at no cost to her. So that's the initial shared value. The second one is that our investments go directly into these communities, and the mobilizers that work with us, the clinics that work with us are on a pay-per-performance in a way that makes them to be able to deliver quality-assured, youth-friendly, stigma-free services to the adolescents that we serve. So collectively, we're able to strengthen that system that is closest to that girl and have a grassroots-driven approach. The last point really is around the fact that at Tiko, we don't duplicate, we leverage, we interconnect and make that system work.
So this award comes at a really critical time for women's health. And I'd love to hear a bit more from you about what this award will allow you to do and how it will help you to better serve the communities you work with.
We're early on in our journey of integrating gender-based violence prevention and management into the Tiko model. We have a lot of experience delivering contraceptive services and HIV services to adolescent girls. This investment is going to help us to refine the integration of sexual violence prevention and management into our work. What that means is that we will be able to take a more girl-centric, survivor-sensitive approach to this work. Secondly, because of how our model strengthens an existing ecosystem, we're going to be able to strengthen the community response to adolescent girls, making sure that we heighten understanding that sexual gender-based violence needs to become completely unacceptable, and making sure that communities themselves organize to have a response. Lastly, this investment is going to help us to strengthen the health system that includes both the public sector and the private sector, to be able to provide comprehensive support to girls who come in. And so we are looking at impacting 3.5 million girls at minimum with an integrated model that ensures they are screened for sexual violence, they have awareness around it, and that the communities around them build a support structure to ensure that in the event that they survive violence, they will have the most critical care so they can be resilient and really achieve their life's goals.
So I'm excited to follow what you do with this award and would love to just hear you expand on what's next for your organization and what you hope that others take away from your work. I would say whether they're tackling these challenges or other challenges in global health and development.
We are working really hard in the next 5 years to figure out what an integrated approach to sexual reproductive health looks like. We are working to ensure that we can demonstrate a model that works for girls, a model that indicates that sometimes girls show up in the health facility to ask for a contraceptive service, but what really they need is somebody to address a rape that happened yesterday night, with both a biomedical response but a critical legal support and also protection support that girls need. The other thing that I'm hoping that we can all learn is that we need to invest in the lives of girls for the long term. We will leverage on this resource to ensure that governments can also co-finance on this response, as well as other private philanthropy and private sector within the countries where we live. And so this is going to be a catalyzing investment for us that can indicate how long-term investment in an integrated model needs to look like for the adolescent girls and young women in sub-Saharan Africa.
Thank you for all you're doing to, as you put it, figure out a model that works for girls. Looking forward to following your work, and thank you so much, Sarah, for your time.